It's James with NetNewsLedger. We sat down with Minister Hajdu.
Merry Christmas from Thunder Bay. We're with Minister Hajdu, the Minister of Health, and the Minister for Thunder Bay Superior North. Welcome to your new office out here at Marina Park.
Well, it's very northern, that's for sure. I don't think some of my southern colleagues understand just how snowy and wonderful it is up here at this time of year.
You got your mandate letter from the Prime Minister this week.
I did.
You've got a lot of work to do.
I do. Yes, I have many items. Some of them will be obviously a little more easy than others. There are some big challenges in the mandate. Some of it is not surprising at all. As you know, we campaigned on things like taking the next steps on a universal national pharmacare plan, making sure that people have better access to primary care and physicians across the country. And I'm kind of honored to lead those two pieces. Certainly the piece around access to primary care is something that I hear all the time in Northern Ontario, but the cost of medication is significant for people as well, and there are big gaps despite the fact that many people do have coverage through private plans. What's
your first area you're going to be working on?
Well, I don't think we do it in a sort of linear fashion. There'll be lots of work happening simultaneously, but I think the first thing I've actually already started is reaching across the aisle to the opposition parties and talking to my critics about what their vision is in terms of my mandate, but also in terms of priorities that they might have. I've already started talking to my provincial counterparts as well, because obviously for my file, much of what I hope to be able to achieve will be done in partnership with provinces and territories, and so I've already started to have those conversations with my colleagues about what their visions are, what their priorities are that they're seeing across the various provinces and territories in the country.
Here in Thunder Bay Superior North, what's your message for the constituents?
Well, as many people know, I've held, this is my third ministerial portfolio that I've held now since I've been elected, and so I want to reassure members of my communities that despite the fact that this may seem like a bigger portfolio, I'm very comfortable being a minister and a member of Parliament, and of course constituency comes first. So people need to know that when they call the office or when they ask to meet with me or they want to have a conversation with me, that I'm always available, that my staff are really good at tracking me down no matter where I am in the country, and I can have conversations by phone or digitally or in person. And so I will continue to put Thunder Bay Superior North first. I'll be out in the riding in the new year, so it'll be a great opportunity to visit the communities and talk with people about what their specific community needs as well are in addition to the health issues that people will no doubt want to share with me.
And all the best to you and your staff and family for a great holiday season.
Well, thank you so much. It's going to be a wonderful time to reflect, but then to get ready and prepared for a very, very busy season in January.
So you don't get the long, cold winter nights to just rest. It's work and business is hard work.
I think I'll be doing some reading over the holidays. I will take a couple of weeks off with my family to enjoy the season with them, but I obviously have time to absorb some of the information I'm going to need to understand in order to be able to lead this portfolio. But then in January we'll be right down to business. A lot of travel, a lot of discussions with my colleagues, and a lot of consultations with Canadians about how we make these visions come to life.
Thank you, Minister Hajdu.
Thank you very much.
Easy.